Parenting becomes harder in a world where there are no parks to play in, no school counselors to talk to, and no social workers to intervene early. It is no surprise that ACEs, adverse childhood experiences, are a strong predictor not only of psychiatric disorders, but of physical illnesses like heart disease and diabetes. ACEs don't arise solely from the parent-child relationship. They come from violence in the home, instability in housing, systemic racism, lack of safety, and food insecurity. If society creates the conditions for ACEs, then it holds the responsibility for healing them. The parallel between parent and government becomes especially clear when we consider the role of empathy. Just as a good parent tunes into the emotional needs of their child, noticing when they're withdrawn, angry, or insecure, a good government must attune to the collective mood of its people. Are we overworked? Undersupported? Is there a national loneliness epidemic? Are suicides on the rise? These are cries for help at scale, and the appropriate response isn't policing or punishment. It's policy. For example, Japan appointed a Minister of Loneliness in 2021 to address rising suicide rates linked to social isolation. This shows an institutional recognition of emotional suffering, just like a wise parent who notices their child withdrawing and takes action. A good government does not wait until breakdown or rebellion. It creates proactive, preventive structures, just like a good parent sets routines, healthy boundaries, and nurtures safety. Let us also remember that mental health is not merely the absence of illness. It is the presence of purpose, connection, autonomy, and hope. In psychological terms, self-determination theory tells us that humans need competence, autonomy, and relatedness to thrive. These don't just come from good parenting, they require social opportunity. It is the state's responsibility to ensure that people have access to meaningful work, education, spiritual nourishment, and community. During the COVID-19 pandemic, the inadequacy of mental health systems was exposed globally, and it became clearer than ever that public health and mental health are inseparable. Countries with stronger public infrastructures fared better, not just in viral containment, but in maintaining psychological resilience. In contrast, communities with deep inequality saw disproportionate mental suffering. Furthermore, the rise of artificial intelligence, digital addiction, and social comparison culture on platforms like Instagram or TikTok are now influencing the psychological development of children and adults alike. A parent cannot shield their child from algorithmic manipulation alone. This requires regulation, tech accountability, and digital literacy education led by governments and schools. A parent can teach values, but a child raised in a society obsessed with consumerism, speed, and image will absorb those values unless there is countercultural support at scale.